Hi, my name is Foreman, and in this video I'll show you how to examine a knee. So this is Matthew, he's my patient for today. So first of all, I'm going to start by observing Matthew's knees. So what we're looking for is any signs of swelling, any old surgical scars here, any obvious deformities, looking at his feet alignment to make sure they're straight, and just looking at the general posture of the legs. We're looking for any signs of muscle wasting in the legs at the top here and in the calves down below. If you can turn to the side for me. Again, looking at the side of the knee, making sure there's no deformities there. And if you turn around to the wall for me, face the wall. And at the back, again, we're looking for any signs of surgical scars, any swelling such as Baker's cysts at the back of the leg. So first thing I'm going to ask Matthew to do is if you can walk for me. And when he's walking, we're just observing his gait, looking for any signs of an antalgic gait, which means he might be in a bit of pain in the knee. That was all okay. And now what we're going to do is we're going to examine your right knee in this video. So if you could go onto one leg for me and do a single leg squat on your right knee. So you can squat down on your right knee. That's great. And when he's doing that, we're looking at the alignment of the hips, making sure they're nice and straight, and to see if he's in any pain with the knee. Were you in any pain there? Okay, great. Right, if you can take a seat for me, I'll lie down on the bed. I like to start at the bottom of the bed, and here I'm just looking again to make sure his feet are nice and straight. Looking to see if there's any leg length discrepancy. We should always screen the hip when we're examining the knee, just to make sure there's no hip problems. And I like to lift both legs up, just to see if there's any obvious signs of hyperextension there, which there doesn't seem to be any. First of all, I'll quickly screen the hip joint. Are you in any pain in any of the hips at the moment? No. So I'll start by asking Matthew to lift his leg straight in the air for me. And straight back down. Any pain there? No. And if you go up again for me, bend your knee. And I'm just going to check for any pain on internal and external rotation of the hip. Any problems there? No. Okay, now we'll move on to examining the knee. And the first thing I'm going to do is look a bit closer. Any signs of any swelling, any temperature differences in the knee, any signs of surgical scars, have a feel on the back for any obvious cystic strictures there. And we'll start by doing a patella tap. This is to check for any effusion in the knee. So we melt down any of the fluid that could potentially be in the knee and press down on his patella here. If there's any fluid, there'll be an obvious bounce there. The other thing we can do is a sweep test, where we sweep the fluid out of the medial side, round to the lateral side, and again back around. If there's any effusion, we're likely to see ripple in there. All okay? Yeah. No pain at all? No. That's great. Right, now we're going to examine the knee with palpation. So I'm asking to bend his knee up. I like to do it in this position. It makes the structures a bit more prominent. And we'll start on the medial side of the knee. Press in on the medial joint line. Any pain at all? No. Let me know if you are in any. Coming around to the patella tendon and the tibial tuberosity. And over to the lateral side of the knee. Any pain at all? No. You can press around the patella, examine around there. And up to the quadriceps tendon. Any pain there? No. No. Any pain in the calf? No. And any pain in the quads? No. No, that's fine. Okay. Now we're going to move on to movement of the knee joints. So first of all, I'm going to ask Matthew to bend his knee up towards his chest and back down. So just good flexion of the knee joint there. And now I'm going to do it for him, feeling for any crepitus in the knee. Flexion, extension. Great. There's a bit of crepitus there, but that can be normal. Now we're going to check the other structures in the knee. We're going to check for the anterior posterior cruciate ligament and the medial and lateral ligaments. So first of all, we're going to lift his leg up. We're going to add some valgus force onto the side, feeling for the stability of the medial ligament first. And then on the opposite side, some varus force, feeling the lateral ligament. They both seem very tight and normal. What we're going to do now is Lachman's test. This is testing for the anterior cruciate ligament. And to do this, we'll lift Matthew's leg, just ask him to go nice and floppy for me. We're just going to put a bit of draw on the tibia, pulling it forward, looking for any laxity there. In people with big strong legs, the best thing to do is put your knee underneath this. Do you mind if I put my knee underneath yours? Put that on the bed. Nice and floppy, and again, pull forward on the knee. As you can see, nice and stable. We can do an anterior and posterior draw test, where you bend the knee up. You ask the patient, do you mind if I sit on your foot for stability? Here, if you can see, if you come on this side, is that? You push on the tibia, checking the posterior ligament, and pull, checking the anterior ligament. That's all fine there. The other test we can do for the anterior ligament is the pivot shift test. To do this, pick Matthew's leg up again. Externally rotate the tibia, put a bit of valgus pressure there, and push up. Any pain at all?
No.
From extension to flexion. This, if positive, should give the same experience they did have when they did pop their anterior cruciate ligament. So we test the anterior, posterior ligaments, medial and collateral. Now we can move on to meniscal tests. To do this, there's a test called McMurray's test. Lift the knee up, fully flexed. Interior rotate the leg and pull out. Any pain there at all? No. What we're trying to do is trying to catch a meniscus on the tibia. There we go, that's fine. Now what we do is we ask the patient to roll onto their front. And we do something called the grind test. This is checking for any posterior structure deformities or any problems there. And we ask you to, can you bend your leg up for me? And the other one. And if you bend this one back up, you can straight this one back down. And you grab the foot there, and you literally do a grinding motion. Any pain in the knee there? No. That's fine, and you can check the same on the other side. There is another test called Dial's test, where you can ask the patient to flex both knees up. And with this one, you grab both feet, and you twist out. Any pain in the knees at all?
No.
That's fine. Lastly, we ask Matthew to stand up. To complete the exam, I've checked the neuromuscular function of both legs, doing a full neurological examination and screening the ankle joint and the hip joint. And that's how I examine any. Thank you.